Hi, welcome to the Take 5 podcast, the show that helps strengthen firefighters in protecting those relationships that matter most. I'm your host, Lee Sullivan, licensed mental health counselor and certified emotionally focused therapist. I'm so glad you're here today. Hi, welcome back, you guys. Today we're going to talk about counseling and therapy, and it can be a very confusing process. And so we're going to talk about the common therapeutic models, the common types of therapy that are used to treat trauma. And we're going to discuss the research on why they work and when specifically they should be utilized for firefighters, according to the research. So let's dive right in. There's some common categories for counseling and therapy regarding healing trauma and traumatic injuries. These are cognitive behavioral therapy, or CBT, behavioral therapy models, and attachment-based models, such as emotionally focused therapy. There's a lot of confusion among professionals on why each one of these interventions work and when it should be applied, specifically regarding healing traumatic wounds. And it leads to some confusion for lay people or those who are seeking counseling. And so today we're going to break down these categories into the different types of therapy. We're also going to understand and sort of pull apart the differences and what they each should be used to treat and heal. I recently attended a mental health symposium on trauma wounds, and this therapist who was the presenter was highly accredited, very knowledgeable about trauma and how the brain experiences trauma, how we somatically or bodily experience trauma. And there were several people in attendance. There was about 50 folks who were in the audience listening to him. Not all of us were professionals. There were a variety of people attending. Some of us were professionals. Other people had personal experiences with trauma. Some were pastoral counselors or religious, in the religious sort of lane of therapy, where in Washington State they're not allowed to call themselves counselors, but you can use the term pastoral care or pastoral counseling. Those are unlicensed professionals, but they do have a lot of real life experience in helping people. And the title of this presentation was Trauma and Healing. And he went into a great amount of detail regarding how our brains and how our nervous system, specifically how our vagal nervous system, experiences trauma. And it was really educational and helpful. The audience seemed to be tracking really well. There was a lot of tracking responses, nodding of heads, oh yeah, A lot of people around me were taking notes and seemed to be really tracking with the speaker, who was very good. I don't want to give the illusion that he was in any way not informed. He was fantastic. He offered a list of several ideas for healing trauma. Of these things, of his list of healing interventions, were breathing techniques, grounding techniques meaning identifying kind of things around you in your environment. It brings you into the present moment rather than reliving that experience in your head. Identifying our somatic response when we're feeling traumatized. In other words, he walked us through how to determine if someone is feeling constricted, if they have a tight chest. Do you feel it in your shoulders? Where on your body are you feeling tense or constriction? He talked about prayers and mantras as far as soothing the threatened brain. And then he also suggested that a hug could help soothe the threatened brain as well. And while some of these techniques or interventions are mindfulness techniques, they're all behavioral interventions, meaning when you change your behavior, you will change your emotional reaction or response to what's happening around you in the present moment. So we've already talked in previous podcasts about James Gross's research, which was published in 2014. And his colleagues, they actually studied the time course of emotion. And what they discovered was that it takes the brain 1/10 of a second to register emotion and 6/10 of a second to register cognition. In other words, we understand through fMRI studies or imaging and EEG imaging through James Gross's research that we register emotion a half a second faster than we register cognition. The old science, in other words, 50 years ago, 50 plus now years ago, it was widely accepted by therapists and psychologists that we think, then we feel, then we behave or we act. In other words, we have a cognition, then we have an emotion followed by a responsive behavior. As we can see, not just through James Gross's research, there's many other empirically based research studies now. New science, which is in the last 20-25 years of psychology and neuro research, neuropsychology. Science has proven that we feel first, then we think, then we behave or act or react. Why is this important? It's important because we can understand that an incident that is determined as traumatic or altering can only be determined by your own narration, your own emotional experience of that event. So simply put, I cannot hear you tell me about the critical incident that you ran a call on last night, and I determine for you that it was traumatic for you, or that it was labeled as trauma for you. You have to tell me your emotional experience, and you tell me about your distressing symptoms, and based on that, it's determined as trauma, that you've experienced it as trauma. So when you tell me you're reliving the scene, when you tell me that you can't stop thinking about it and you can see, smell, taste, feel every part of that critical incident as if you did a week, 2 weeks, a month, a year ago, when you tell me that your present moment takes you right back, catapults you into that moment in time in your past, when you tell me that when you recall the scene, you start to sweat, your heart rate increases, you might feel anxious, you might feel fearful that you're not safe. By your own account, you're telling me that you've been traumatically impacted by that critical incident. Your feelings of your own experience allow you to determine that that critical incident was traumatizing to you. Simply put, our emotional experience of a critical incident or the impact of a critical incident is what determines whether or not you have a trauma injury. Does this make sense why cognitive and behavioral, or just behavioral, straight behavioral therapeutic interventions at best have very short-term results? It should. This should start to make sense to us now, because if the impact of a critical incident determining whether or not it's deemed as traumatizing to us, is based on how we feel after the incident, then cognitive and behavioral or straight behavioral interventions are at best going to have a short window of impact. There is a lack of sufficient evidence within the existing literature to demonstrate a positive outcome of cognitive behavioral and behavioral therapy, which is a subcategory of CBT therapy, for reducing symptoms of post-traumatic stress injuries for longer than 12 months. Emotionally focused therapy, which is an attachment-based therapeutic model, in multiple research trials has shown to have a decrease in post-traumatic stress, depressive symptomology, and is shown to mitigate the impact of trauma beyond 36 months after treatment has ended. An attachment-based model of therapy is shown to mitigate symptoms of a critical incident, post-traumatic stress injuries, symptoms of post-traumatic stress, 3 times longer than cognitive behavioral therapy. This should start to make sense to us when we understand that our bodies and our brains experience trauma, determining that it's traumatic based on our emotional experience. That is really important for us to understand. It's really important for professionals to understand as well. So let's take a closer look at the commonly used interventions like the ones that were cited in the symposium that I happened to go to. Breathing and grounding techniques. These are great for getting you out of reliving that experience in the past, reliving it in the present moment. It's not healing long-term though. Let's use that intervention appropriately. It's going to help get you out of a fight or flee response, and it's going to bring you into the current present moment, understanding that you are safe today where you weren't safe then. You are safe here and now. However, let's not confuse that with a long-term healing intervention. Identifying a somatic response, like, hey, how's your heart rate doing? Where do you feel the stress? Where do you feel tense? Where do you feel constriction? That's great for mindfully distracting you again away from feeling your emotions and focusing instead on your bodily response. Okay, so it's a great distraction to bring you present moment. It's a great distraction to stop feeling a sense of panic, a sense of fear, and bring you instead into your somatic experience. But again, let's not use that distraction, which is great for bringing you present moment, helping you get away from feeling a sense of panic. But let's not use that distraction intervention and confuse it for long-term healing. Prayers and mantras, they soothe the brain because you're connecting with God or a higher power. You're connecting that spiritual side of you, which everyone has a spiritual aspect to their person, however you define that. And so it helps to soothe your threatened brain in that moment. Again, though, let's not confuse that with a long-term healing intervention. Hugs. that he recommended. Yes, they soothe the threatened brain because you feel that you're not alone in your terror. So that's why hugs help. Okay, but I just want to separate and sort of untangle short-term cognitive behavioral responses to an emotionally charged wound, which requires emotional therapy. So when you are looking for a culturally competent counselor to help you with critical incident stress management, when you're looking for some help, you're having troubles reliving past traumatic incidents or critical incidents, ask them, what kind of interventions do they use? Ask them about how they understand or what is their perspective on trauma. How do we experience trauma? That'll be a good indicator for you to understand how they also expect to treat trauma or think that the healing happens from a traumatic wound. Ask them about their personal model of care. What do they offer? Do they offer cognitive or behavioral therapy for treating trauma? If so, run. I'm sorry, I'm going to piss off a lot of therapists through this podcast. Those work short-term. Research shows that they work up to 12 months. And of course, they're not going to work longer term than that. We shouldn't need science to show this, but we have it. So thankfully, we have it. But we should, of course, understand that if I'm going to experience trauma through an emotional experience, then of course it needs an emotional healing. I hope this really starts to make sense. Ask about the counselor's understanding of attachment and what kinds of training they have in attachment models. Emotionally focused therapy, that's for the individual and for the couple. Ask them if they understand it, if they have any experience with it or any trainings with that. That is empirically shown to help heal attachment wounding, which is traumatic wounding. Okay. If they don't understand why healing of the impact of trauma requires an attachment form of therapy, then they don't really understand trauma itself. They don't understand the impact of a traumatic event, and they don't really understand what causes someone to experience a critical incident as traumatic to them. I hope this was helpful today. I hope that having a few questions of what you can ask a therapist, a future therapist, helps to inform your ongoing therapy. I hope it also starts to make sense why some of these interventions that we use for fire service in particular don't really work long term and aren't shown to work long term. And many of you have direct experiences with that and say, yeah, breathing technique works in the moment, but it doesn't work beyond 12 months out. It doesn't work 4 months out oftentimes. And so it's because you have an emotional wound that requires emotion healing. Okay? I hope that this helps normalize why we talk about emotion, why we talk about self-awareness, emotional awareness, and how it ultimately builds resilience to the impact of these critical incidents that you experience. Thank you so much for listening today. Thank you for joining me. If you learned something useful, please subscribe to the podcast. I don't want you to miss future episodes. Also, if you have ideas for future content, be sure to write it in the notes, and I'd love to hear from you. And definitely, I'll do the legwork and research and get that out to you as soon as possible. Take care. For a list of references used in today's episode, please visit our website at take5withlee.com. You'll also find more resources for first responders that have been vetted for cultural competence. Remember, What we see, we can change one feeling, one message, one conversation at a time. Thank you for joining me as we learn to tap into our emotion signals, which will ultimately build resilience, protecting and preserving those relationships that matter most. Be safe out there and be well.